Now we deal with a great variety of scars. We deal with acne scars, we deal with any sort of body scar. Now this may be because you've had an abdominoplasty, it may be because you've had a breast reduction, you've got that scar underneath your breast area which has become thickened unfortunately, or you may have even had your areola operated on when it's recreated with the breast and that's become thickened. You don't need to have the surgeon go back and redo it again. That's not going to solve the problem. When a person has a scar, they address it with people who are not dermatologists or plastic surgeons, but we have the necessary lasers where we can just recreate a normal scar to what it should have been as opposed to what's happened. It's just a factor of surgery. Then we move on to other types of burns that we get. We often get contractural scars where someone's had a burn and the burn has caused the skin to severely contract with limitation of motion, and we're able to address these. It does take time, but we can address these and try and restore normal function. We also deal with facial scars from whatever cause, whether they have been caused through trauma, chicken pox, possibly acne, but whatever the cause, we're happy to address it. Other scars that we treat are predominantly self-harm scars. We treat stretch marks. One of the other common ones is, unfortunately, people have ear piercing, and as a consequence of the metal in the earring, it often causes keloid scars. Now it's more common in darker skin than lighter skin, but regardless of what happens, we can treat that with lasers and also with injections to reduce the keloid down, or if necessary, we can excise that keloid. When you present with your scar, I understand the pathology of what's happened to you, whether you've got a red scar, a pigmented scar, a thickened scar, whatever the issue is, we have got the necessary lasers and light devices to be able to address that. And the one thing you don't want to do is have an aged scar. As soon as a scar arises, collagen production's trying to recreate that normal skin, but sometimes it doesn't, in which case the scar is like atrophic or thin. Or in other cases, the problem is that the scar just doesn't know how to control itself and it becomes hypertrophic. We've got to take into consideration the colour of your skin and the thickness of the scar to be able to address each of those issues uniquely. So the earlier we intervene to fix your problem, the better. No matter what scar you've got, we can assess it. We understand the pathology of why it's happened, and that's where the key component of the dermatologist who's a laser specialist can address those issues for you and explain them fully so that you understand that the laser you're getting is appropriate for your needs. Whatever the scar that you present with, we can address it. We can definitely improve it. It is just such a great thing to be able to offer people laser devices which are world state of the art, whereby we can achieve the results for you. They're proven overseas. We've introduced them to New Zealand and we want to work with you to achieve the best results currently available in the world.